Very much. Thank you to you.
Association, Karey, Shuhendler.
Thank you, Mr. Chair. Good afternoon, Mr. Chair and members of the committee. My name is Karey Shuhendler, and I'm a registered nurse and program lead for public policy at the Canadian Nurses Association, the national professional voice of more than 139,000 registered nurses and nurse practitioners. I'm pleased to be here today with Professor Lynda Balneaves, registered nurse and medical and non-medical cannabis researcher, who will be able to answer questions that may be more technical in nature. At the outset, I'd really like to thank the committee for studying this important issue and for inviting CNA to provide its recommendations. CNA supports the passing of this bill and believes that upon removal of cannabis from the list of controlled substances, adopting a legal framework is an excellent option for addressing the potential health and social harms of non-medical cannabis. In addition, while we recognize that Bill C-45 is largely focused on the recreational use of cannabis, there are opportunities to ensure that the legislation does not inadvertently negatively impact access to medical cannabis. CNA has provided several recommendations for amending the proposed legislation, all of which are outlined in our brief, which will be submitted before the May 4th deadline. We encourage the committee to include all of CNA's recommendations in your final report, including those related to the promotion and sale of cannabis and cannabis accessories, with considerations around promotion and use related to alcohol. Cannabis should not be treated the same as alcohol. Harms of alcohol use and current alcohol policy can be downplayed at times and should not necessarily serve as the model for cannabis policy simply because it is a process that's already established. Additionally, cannabis is different in that there are therapeutic indications and particular formulations for medical use. Today, we'd like to focus on two of our recommendations, namely those related to medical cannabis and to youth criminal penalties. Our first recommendation is to emphasize the need to exempt medical cannabis from the application of Sections 8 and 9 of the Act, so as to effectively maintain a separate regime for medical cannabis. CNA supports the need to preserve access to cannabis for medical purposes based on the principles of access and equity. This includes access to appropriate products, access without undue financial burden, and access to care and clinical oversight for persons using medical cannabis. Without such clinical oversight, we're essentially leaving patients to self-medicate and figure it out on their own. CNA believes the intent of Sections 8 and 9 are to govern the use of non-medical cannabis. However, the impact of those provisions on users of medical cannabis has the very real potential of limiting access to a substance that could alleviate serious medical symptoms. As per recommendations set forth to the Senate Committee on Legal and Constitutional Affairs by the Canadian Nurses Protective Society, Sections 8 and 9 of Bill C-45, if accepted as written, impose limits on individual possession and distribution that can have significant negative impact on both the provider's ability to authorize more than 30 grams and a patient's ability to possess more than 30 grams. The bill's prohibition of possession by young persons and prohibition of providing administration to persons under the age of 18 without clear exemption for cannabis for medical purposes mean that young persons aged 12 to 17 years of age would not be able to possess more than 5 grams, or that a healthcare professional, including nurses and nurse practitioners, may be in contravention of the law if they authorize or administer medical cannabis to persons under 18 years of age. Exempting medical cannabis from the application of Sections 8 and 9 of Bill C-45 is necessary not only to preserve appropriate access within a separate medical cannabis regime, and to protect clinicians, including nurses and nurse practitioners, from liability. Our second recommendation is specific to youth criminal penalties. Apart from the undue limitations that it may place on access to young persons to cannabis for medical purposes, Section 8 and related subsections state that for a young person, aged 12 to 17, to possess cannabis of one or more classes of cannabis, the total amount of which, as determined in accordance with Schedule 3, is equivalent to more than 5 grams of dried cannabis, is guilty of an indictable offense and is liable and or guilty of an offense punishable on summary conviction and is liable under the Youth Criminal Justice Act. For youth, particularly those from marginalized or racialized group, a criminal record can lend itself to considerable social harms. It can be a barrier to volunteer opportunities, which are often required by school curriculums. It can be a factor in scholarship decisions, and can also reduce career opportunities and contribute to poverty and poorer health outcomes. Given the evidence that 21% of 15 to 19-year-olds in Canada have used cannabis in the past year, such legislation could potentially impact a large number of youth. Alternatives to a traditional punitive approach to addressing both minor crime as well as problematic substance use have demonstrated success. Examples such as drug courts, which use restorative justice as a guiding principle, offer an alternative to traditional criminal justice processes. These models allow full engagement and accountability of the offender and help to address the broader range of contributing issues such as poverty, health, or social justice issues which may have brought the person to commit the offense in the first place. Consider a 15-year-old struggling with problematic substance cannabis use, caught possessing more than 5 grams. He uses non-medical cannabis to self-medicate for undiagnosed anxiety and depression, which may be exacerbated by the stress associated with living in poverty. Would criminalizing possession or even a significant fine help this teen? Or would he be better served through a drug court system with a restorative justice approach where the teen can be accountable in his own healing, provided with opportunities to link with health and social service organizations that can address the root causes of poverty, and offer treatment services to address undiagnosed mental health and substance use issues? With this in mind, CNA recommends that youth possession of cannabis not be subject to criminal penalties, that the government use a restorative justice approach as the guiding principle for addressing youth possession, and that such depenalization eliminate current or future repercussions for youth by removing the provision under Section 8 and related subsections of the Cannabis Act. I would like to close by emphasizing that the legalization of cannabis is an excellent opportunity to reduce harms associated with both non-medical use and the illicit market, but we must get this right. We must ensure that the legislation strikes the right balance of protecting the health of the public with appropriate safeguards while continuing to support access to medical cannabis. CNA encourages the members of this esteemed committee to incorporate all of the amendments that we will put forward. Please include them in your final report on this important piece of legislation. Thank you.
Thank you very much.